Aphasia is a condition that disables your ability to communicate. Problems in ability to speak, write, and understand language might cause by damage either to Broca's area or Wernicke's area. Causes of aphasia usually occurs because of stroke or head injury. It might also cause by slow-growing brain tumor or brain degenerative disease. There are two types of aphasia, such as non-fluent aphasia and fluent aphasia. Broca Aphasia and Vernicus Aphasia can be treated by speech and language therapy and practices language skill with family members during communication process.
Known as non-fluent aphasia. Communication disorder, difficulties in articulating or self-initiated speech but good auditory verbal. Affect person's ability to. People with Broca aphasia understand everything said but have difficulty finding words to express themselves and able to speak short phrases. This lead to frustration. Results from injury to speech and language brain areas in frontal lobe. Result of stroke, intellectual and cognitive capabilities not related to speech and language fully preserved. Most common cause of Broca aphasia is stroke. Stroke caused by hypoperfusion to brain. Occurs in approximately 12% of new cases of aphasia caused by stroke. Uncommon causes include primary autoimmune phenomenon and autoimmune phenomenon that are secondary to cancer. Case reports specific tend to describe Broca aphasia. It is caused by acquired damage to the anterior regions of the brain, such as Broca's area. It is one subset of a larger family of disorders known collectively as aphasia. Contrasts with receptive aphasia. Patients able speak grammatical sentences. Differs from dysarthria, inability to move tongue and mouth muscle. Differs from apraxia speech, a motor disorder. Best communicate? Ask one question at a time. Encourage the person to use body language and gesture. Also acknowledge their frustration. Vernicus aphasia causes difficulty speaking incoherent sentences or understanding speech from others. Vernicus aphasia caused by damage or lesions in the middle part of the left brain. Stroke also can cause this condition because it interferes with blood flow to the brain. When blood does not reach Wernicke's area of the brain, it can kill brain cells, causing Vernicus aphasia. Aphasia affects 25 to 40% of people who have a stroke. Other conditions that may affect this area of the brain include head trauma, tumors, infections, and also neurological disorders. It occurs when there is damage to the left side of the left brain, known as the Wernicke area, which controls human language. Wernicke area is located in Brodmann area 22, the posterior segment of the superior temporal gyrus in the dominant hemisphere. Wernicke area is responsible for the comprehension of written and spoken language. Damage to this area results in fluent but receptive aphasia.
What difficulties faced by individuals with Broca's aphasia? Individuals with Broca's aphasia have problems speaking fluently. However, their comprehension can be relatively spared. They have difficulties such as difficulty using verbs than using nouns, have harder times understanding sentences with more complex grammatical construct, may be able to read but be limited in writing, poor repetition on what has been said by others, and difficulty in forming complete sentences.
Now, let's talk about the difficulties faced by individuals with fluent aphasia. Individuals with fluent aphasia may be seen to be able to produce connected speech. However, they have a problem in terms of speech comprehension where they often utter meaningless sentences. They fail to understand the meaning of the words spoken by others, and even themselves, causing them to have errors in using words. This is called paraphages. Besides that, the people with this kind of aphasia are also known to have trouble in writing and also reading.